Oh, there she is. Renee, here to save the day.
It's going to go downhill quickly.
Oh, here's everyone.
Feels so special when the host would like me to unmute.
There's something going on with Zoom. It's been really problematic where, I mean, I have it set up where everyone's supposed to be muted upon entry and it's not doing it. So
That's actually several meetings I've been in now. Same thing. The people
Command Center the other day.
Command Center.
We know, yeah.
Yeah, it happened on a lot of larger meetings that need to be muted as much as possible.
Yep, I think it's there's a glitch there in that setting.
Yeah, something's not working.
LJ, I have been working on that thing since I talked to you. I'm sorry I got it to you so late. It just took me that long to put it together.
No worries, Renee. We'll circulate it and get final approval. I'll just sort of talk about it today.
Okay.
Okay.
Let me know if you want it up on screen. I know.
Nope.
Okay.
Nope. I can't until
Understood.
until there's approval on it. So
And
that's okay. Thank
conceptually,
you.
If there's approval, I can make it better and cleaner, you know, I mean, easier.
Okay.
Okay. But just the flow is what to me, it's easier to follow as a flow chart.
Got it.
Okay.
I just passed it back off to Stephen Schultz because he has time right now while we're doing this call. So he'll spend some time on it. Thank you.
It is 12:16. We're at our kind of normal 45 occupancy, so I guess we can get rolling. Welcome everybody. I'm sure there'll probably be a few more people who will trickle in. I don't have a ton today. I'm guessing that LJ probably will have more than I do, or at least be more interesting than I am, which is actually probably always the case. So I'll do my piece very quickly, and then I will get out of the way and let LJ talk about the important stuff. So, you know, from a general State of the Union, volumes in the hospitals seem to be remaining fairly flat. Whereas if you look at community incidence rate, the data would suggest that we're starting to diminish, especially in the last 7 days. So new cases, if you look across the region, were as high as about 6.8% over the last 7 to 14 days. And we've been down hovering around 3%. Since that day 6 forward. So, you know, there's potentially a little bit of good news on the horizon. If anyone's read the statement that was put out by the governor's office, it seemed to be suggested by Fauci, although maybe not quite to the same extreme. People are asking, you know, what do we have to reach between vaccination and infection to achieve herd immunity? And the governor came out yesterday and said it would have to be 90% vaccinated or infected. Now that's, you know, we've toyed with 60 to 70, then it kind of got pushed to 80. Now the discussion is because of how virile the Delta variant is, that it probably has to be higher to ward off that transmissibility. But 90% would be an extraordinarily high bar, to say the least. So of course, that kind of motivated the conspiracy theory side of the world that there is no real number for herd immunity, that it just keeps getting pushed higher, and it's a ploy to get people vaccinated, which if that's a ploy, that's a reasonably good ploy, but nonetheless, that's where it stands. And so, you know, I do think that the underlying message is that as these more transmissible variants come available, that the degree of vaccination or infection has to increase above and beyond what it was in the initial phases because of the ease of transmissibility of these newer variants. So take that what it may, but it does appear from just community-based statistics that the rate of positivity is lower than it was even a week ago, which hopefully is good news. From the hospital standpoint, with the paucity of nursing homes able to take patients, we are seeing a greater preponderance of elderly folks who need placement in nursing facilities, but have to wait for 2 negative COVIDs before they'll be accepted. So it just because there's a stable number of COVID patients doesn't mean there's an increasing number of new COVID admissions or a stable number of new patient COVID admissions coming in. Some of it could be just these COVID positive patients that don't have a disposition and are therefore hanging out in the hospital for a longer period of time as nursing home placement is diminishing. So that statistic is a difficult one to stare at a whole long time either for that reason. The next step is we look across the region at kind of where we stand from a staffing issue. Things seem to have stabilized a bit since the mandate. We had a wave of resignations, people leaving healthcare, even certainly leaving the area because of the mandate in New York State. Then we did have a smaller wave of what I will say, folks who were just burned out from the 20 months of the pandemic and then seeing a reduction in workforce because of people leaving because of the mandate and finally deciding that was the last straw and kind of heading for the hills. From a workforce standpoint, I think we are probably plateauing for the moment. And I say for the moment because October 12th, next week, is when the judge is planning to take up the temporary restraining order for religious exemption allowance. Every indication has been that it is very likely that that allowance for religious exemption very well will get overturned, in which case all of those staff members in hospitals, nursing homes, congregate care settings that claimed religious exemption to avoid vaccination may no longer have that as an option. Now that raises two questions. Number one, that could result in another wave of exodus of healthcare staffing. Number two, what we don't know is if that does get overturned, what will be the timeline before those folks have to get vaccinated? Will it be immediate that they have to, get their first dose within the course of business that day, or will there be some allowance, and how long will that allowance be? So I would say from a staffing issue, we're kind of all eagerly anticipating what that October 12th hearing may bring. And we anticipate it probably won't get drawn out much past that October 12th. So next week, by the time we reassemble, there likely will be renewed discussion for us to have once the judge makes his decision. So that raises the next issue, which is as all of the staffing shortcomings have taken effect, we're starting to see the ripple out definitely to you folks, mainly because of schools and because of reduction in availability of ED and urgent care. So pretty much across the region, we're seeing a 3- to 4-fold increase in utilization of urgent care, and we are seeing ED wait times as much as doubling or tripling, especially during very peak windows of visitation. So that's obviously creating a backlog of patients who can't get into those urgent evaluation settings, so they're reflexing back to primary care, which is clustering all of your offices with folks who are needing to be seen. Some of them for the kind of lower acute issues, such as kids who have a stomach ache who then need to be seen to get back to school, which I know has been a big discussion. Some of them are the folks who may very well actually be better suited in an ED, but because they may face a 6 or 7 hour wait time, are trying to get in to see their primary care physician to avoid that sit and wait triage thing. So there's been a lot of discussions about that. The promise of some kind of state relief continues to be discussed, although it's not exactly clear what that may look like. But I think that is the place we are now, is the existing healthcare provision locations are getting extra strained, partially because of staffing, partially because of decreased venues for patients or outlets for patients to get that care that they're searching for. So, I think the state relief right now is probably going to come in the form of relaxation of documentation requirements and decreasing licensure requirements, and probably trying to loosen some of the restrictions as far as what are the testing needs for certain scenarios, What's the requirement to be seen by a physician if you have symptoms, blah, 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 blah. So it'll be interesting to see how this plays out in the days ahead, because we're starting to see that near crisis level where it's bubbling up, and the lay public, which I think were largely unaware of all of this for the longest period of time, are starting to realize that lack of access across the spectrum, and now that's getting elevated to the legislative area, and so it's starting to create some pressure to some extent. So we'll see where that goes. Unfortunately, if all indications that this religious exemption gets overturned, it is likely to make this more difficult in the short term. Although I will say it has created an interesting dynamic where downstate medical providers and facilities are more inclined to say, yeah, stick to the everyone must be vaccinated and just terminate anyone who isn't. And largely because there's fewer unvaccinated individuals in the downstate area, if you look population-wise. So the larger medical providers who may have more sway are more disinclined to support any prolongation of this process. And I think the governor, who is looking to get reelected in 12 months time or so, is seemingly more apt to stick by her guns, which probably will mean that we're going to face some increased pressure from staffing shortages and outlet restrictions in the short term. So that makes everything LJ is getting ready to talk about even more important, because trying to figure out a way to triage and improve flow and diminish those demands unnecessarily is going to become even more crucial in the days ahead. So I can tell you that those conversations are going on frequently. It seems like at least daily, if not multiple times a day, there's some group that's meeting, that's passing information to this group, that's passing information to the governor's office, or meeting with the governor's office directly, because I think people are starting to realize the kind of critical nature of this more and more as we get into it. So that's kind of where we stand at the moment. The other issues that I will just quickly bring up, boosters. A few folks have reached out wanting to know where staff or themselves can get boosters and how to get access. So several things I will say pretty much across the board. And if you find otherwise, please let me know. My understanding is that anyone who is providing boosters is largely just requiring that you attest that you meet the criteria of an at-risk individual. So if you're in that high-risk group, that 65 and older, have a medical issue that immunosuppresses you, you just have to attest saying that that's the case. If you're in that younger group, but still at risk, which is what the CDC recommendation is, that it should be considered in at-risk folks under the age of, I think it's 65, you just have to attest that you're in that group. So it doesn't seem that there's a big onus of proof. So for folks who are looking to get those booster doses, I think you can probably fairly readily get them in the community at this time. The U of R did open their booster clinics. Those spots, the initial wave got filled within moments. So they are looking to open up somewhere in the order of like 1,000 additional spots just in this next week, and are looking to try to ramp up from there. Again, with shortages in staffing, there are fewer and fewer people that are available to do these kind of booster clinics like we were doing when we were doing the first wave of vaccination. So that is another place where we're starting to feel that crunch, if you will. But I don't think that access should be an issue, given that any place that's giving boosters is seemingly able to and willing to provide it with minimal attestation requirement. So just want to put that out there as well. Other than that, I think that's all I have for now. So I'll turn it over to LJ so she has plenty of time. So I'll shut up.
Okay, so I'm going to preface everything I'm going to say with the fact that I do not have the answers that you are hoping I'm going to present. So I have information, I can report on progress, but I know that what I'm going to say here is not going to satisfy how people are feeling right now for an immediate solution. So that having been said, there has been a lot of work that's been happening. It just nothing can seem to happen quite fast enough. Later today, Monroe County Department of Public Health will be reinforcing their guidance around students and staff and what is required if they become symptomatic and what is required for them to return to school. I'm not sharing any, images of anything because it's not been released, but I can share with you that essentially the Department of Health guidance is going to be very much, continues to be very much in line with the New York State mandate, which basically the New York State mandate requires that a student or staff member who is symptomatic get tested and that they have a result to be able to produce. And that is a COVID PCR or nucleic acid amplification test. There is still not been any change in allowing antigen testing at this point, but that is a big question. Like as Chad mentioned, that is one of the things that is anticipated may change, and we don't even know what that will exactly look like. But there has not been a change in allowing antigen testing for symptomatic patients in terms of return with a negative test. If someone gets an antigen test and it's positive, that holds. But in terms of a negative test, the thing that the Monroe County Department of Public Health is doing is definitely amplifying in their algorithm and messaging that this is, of course, regardless of anyone's vaccination status, that the symptoms are still all the same symptoms that, we've been checking off for the last 18 months. But that they are strongly recommending that an individual seek an assessment from a healthcare provider to determine appropriate care. But in terms of what a family, what a child needs to produce to the school for reentry, it is the test result, the negative test result that qualifies, and it is in the event that there was an alternate diagnosis or a pre-existing chronic medical condition where this is not deemed to be COVID or felt to be consistent, that those would be the cases where a healthcare provider note would be required. So I know for many of you, you have been asked by schools that they want to have documentation also that you've seen the patient. So that being said, that would make it feel like at least getting back into school with a negative result might go a little bit faster, right? But what we worry about from a healthcare standpoint and what you all worry about is if everybody only thinks about COVID and thinks, if my child is sick, I only need a negative COVID test, what is going to help drive the right level of care for the kids in our community and make sure that there is some level of assessment that happens and that those kids who are sick or with systemic symptoms are making it in for an evaluation. Whether you determine that that's a telemedicine evaluation or an in-person evaluation, we need to assure that the messaging to the community is very clear. Not everything is COVID, and COVID can present serious, things as well, but we still need for good triaging to happen. So in addition to the guidance that's coming out, the county guidance, what will be coming out from the schools reopening safely, the Finger Lakes Task Force later today also will be essentially a healthcare provider workflow or algorithm that would guide symptom assessment. So this is not evidence-based, this is practical. But since everybody's getting a test, if you have symptoms, it makes a lot of sense that not everybody would have to be seen, particularly if kids have milder symptoms. So milder meaning being the things that you guys have been telling about forever, the 2 times of sneezing in school, mild nasal congestion, transient nausea or vomiting, transient symptoms. So the milder symptoms that are not systemic with fever puts you into a different class. And our recommendation would be that healthcare providers, across the region, and in that space, I would say we hope to include school nurses in that category also, can look and then determine this child really needs to go to their PCP or contact their PCP. This child could go to get a test. Now that's a great solution if you have places you can send to for testing. And that's what we have in very limited fashion right now. So I want to tell you what is available, where You guys may know more than that. Feel free to put more in the chat if you know more that are available right at this moment. But our 2 independent pediatric urgent cares, the pediatric urgent care of Rochester and Parrington, and then Acute Kids and Webster, who've been great partners throughout the whole pandemic, are taking patients on referral. They need to sign up for an appointment. It's not just a walk-in thing, but they can do the COVID PCR testing. Their offices, just like yours, are held up by supply at the moment. I think that people recognize that, but they are, like you are, swabbing and sending to URMC labs. I think the other site to just let people know about is that within Rochester City School District, school-based health centers and some of the Golisano Children's Hospital telemedicine techs are trying to really provide some on-site, in-school PCR testing access for kids who become symptomatic. It's not taking care of the whole city school district yet. We're trying to build that out, but we are trying to make sure that there's some focused efforts and energies in that space. And then there is a group we learned about yesterday called Same Day Health that is also in Parrington. This seems to me that this is different. This is not on referral. This is kind of you self-select that you or your child have symptoms, and there's a paying route to be able to do that. Insurance will be billed if you have insurance. I'm not advocating that approach because I think that's contrary to what we're talking about, where there's some level of assessment that happens, but I would be remiss not to mention that that is out there. URMC urgent cares right now are still seeing patients just as you are, but they are so backed up, just as you guys are, they can't accept the referral from a healthcare provider to just do the test. We've gone through that. They don't have the capacity to do that. So over the last 10 days, there have been, or week to 10 days, there is a lot of, there have been a lot of meetings pulling together both the Rochester Regional and URMC health systems, the health departments, the labs, trying to figure out if there's a way to temporarily set up some PCR COVID swab and sample collection stations where patients could go on your referral or on a health provider, a school nurse referral for kids with these very mild symptoms. Or for kids that you've done a telemedicine assessment and determined, they need a swab, right? Something to decrease that workflow. So I can tell you what's coming, and not any of this is established yet, but by early next week, Golisano Children's Hospital with URMC will have a centralized swab and sample collection site to fulfill this purpose. I know for certain that Pediatric Urgent Care of Rochester will be expanding their service provision in that space, similar to what they're doing in Buffalo. So we'll have more capacity to be able to do that. Acute Kids, again, is offering their services in that way. Monroe County Department of Public Health is looking to utilize space at the Fleet Center where they've been doing vaccination to be able to stand up some of this as well. And then there are some pilots starting in the outlying counties, partnering with the lab system. So I know that one is starting soon, and that's Wayne County. And Wayne County will be working with the lab systems to be able to establish a more rapid turnaround and access for families in this space. I say temporary because all of you hopefully will get some of those of you who have reagent shortage right now on your Cepheid platforms or other things may be able to get more in supply, but and hopefully that will decrease some of the need with this. But at the same time, we also don't know what's going to happen in terms of the antigen testing. And so if antigen testing takes over some of this, there will be less need for PCR. Not saying that antigen testing is suddenly better than what it was before. There's still that risk, right, of having some false negatives. But at this point, if we're like collapsing the whole primary care and rest of the health system, from a risk benefit standpoint, it's kind of a no-brainer. So I think the last point that I wanted to make is that the other thing that's a problem, and we recognize this, is the turnaround time and the reporting, right? So even if you're testing in your office and you're sending, for a variety of reasons, you may not be getting those results back as fast as we would like to see that happen. I can tell you that pediatric patients are on a high priority for our labs, both within URMC and Rochester Regional, to try to turn these around. And we're looking at some strategies right now that might help. So I would say if any of you are having concerns around courier pickup, that would be a nice thing to just, pop a message off to me, or I'll say it can be me, or I don't know if Renee can volunteer you for that too, but we'd like to collect that information and make sure you're getting efficient courier processing. The fact that the Rochester Rio went down last week in the midst of all of this was sort of like, I really think most people felt like the sky was truly falling or had fallen at that point. But it really shone a light on the fact that if you're outside of Epic in your health system, like you couldn't access that at all. If your patient had MyChart access, I'm just speaking in the URMC system, they were able to get their result back, but you guys couldn't get them at all. So we're trying to look at workflows that would actually allow a speedier resulting, even if it's just to the family, not taking the place of notifying the healthcare provider, but there would need to be, and we're hoping this will be finalized, accountability for a call to the referring PCP if there's a positive, just so we're picking up on those right away and we're all aware of that, but potentially a way that families could access that test result even quicker, because it will allow getting back into the school setting faster. So that may have been very confusing to folks. It may not be, like I said, what everybody is hoping to hear, but that really is the state of things. Renee, you've heard me talk about this 100 times. What did I miss in that whole thing?
I don't think you missed a thing.
Okay.
I think you nailed it.
So I'm looking in the chat really quick, and I saw there was a question about where kids can go for free PCR testing. So I would say to you that any of these sites that are getting set up right now, I can assure you the GCH site will provide free testing if someone doesn't have insurance. The county sites definitely will do that. If someone has insurance, they're more likely to be billed because it would be covered under insurance because it's a symptomatic test. But we want to make sure that no one is turned away from any of these sites that are being set up. And I don't know if any of the independent urgent care folks are on the call. If Kathy Grisanti or Krista is on, they could certainly comment from their sites how they handle patients without insurance. I don't know if anybody's on. We can find that out. Was there anything else in the chat?
No, I think most of it you covered during the discussion, if I'm not mistaken.
Okay.
Anything
Yeah.
else?
People covered the urgent care. That's the URMC urgent care. They are not going to turn away patients, but they need to see the patient and do the test. They can't sustain the workflow of just this is all volume and staffing. It's exactly what you're experiencing in your own offices.
Yeah.
I'm really open. You're welcome to unmute. You're welcome to offer feedback or suggestions. This is quite imperfect.
Well, people, anything else, Renee, that you wanted to on any topic? Nothing. Okay.
Nothing for me other than we need to decide if we're having another call tomorrow. We put that out yesterday or last week rather, that we were going to do a call as well on Thursday.
Yeah, I would, if we could, just maybe a quick show of either your hand or a post in the chat. People may not want another call because they just need to be seeing patients. But if you would like us, we talked about holding a call with the primary care teams just to determine, in addition to all this other stuff around testing and workflow, are there other things that we could be really conscientious about with from AHP standpoint, either advocating on your behalf, supporting your practices more directly in some way. It's really an opportunity for our AHP team beyond Chad, Renee, and I, but some of the other team to join and listen in and problem solve a little bit, sort of like early in the pandemic. So I'm seeing some yeses. So I think we'll go ahead and hold that. Awesome. Okay.
So
It
12:15
would be
tomorrow.
good to,
same login information, and we'll put that out in an email this afternoon. Sorry, LJ. didn't interrupt.
And that, no, and that will be a facilitated discussion. So we'll ask you guys to unmute and talk, and you can use the chat, but we really will try to get some conversation going, and there will be more of us present. Good point from Toby about high deductible kids getting squeezed in terms of paying for their COVID tests. So thank you for that. I'll be bringing that point right back into a meeting where that's being discussed today. Thanks, Toby. Okay,
Any other topics before the good of the order? All right, seeing and hearing none, we'll adjourn and we'll come back together tomorrow, same time, same place.
thanks,
you.
everybody.
Have a great day.